Question 1. A nurse is preparing to administer digoxin to a patient with heart failure. Which assessment is a priority before administration? A. Monitor serum potassium level. B. Check patient's respiratory rate. C. Assess for peripheral edema. D. Evaluate hemoglobin level. Answer: A. Monitor serum potassium level. Question 2. A patient receiving morphine post-operatively is difficult to arouse and has a respiratory rate of 6 per minute. What is the nurse's immediate action? A. Call the healthcare provider. B. Administer naloxone. C. Place the patient in Trendelenburg position. D. Perform a complete pain assessment. Answer: B. Administer naloxone. Question 3. Which task can the RN safely delegate to the LPN in a patient receiving IV chemotherapy? A. Administer the chemotherapy. B. Monitor for signs of extravasation. C. Provide patient education on chemotherapy side effects. Determine the need for antiemetics. Answer: B. Monitor for signs of extravasation. Question 4. A nurse is caring for a patient taking warfarin. Which patient finding requires immediate intervention? A. INR of 3.0. B. Bruising on the arm. C. Hematuria. D. Headache. Answer: D. Headache. Question 5. A nurse is reviewing orders for a patient with renal failure. Which medication order should be questioned? A. Erythropoietin. B. Furosemide. C. Ibuprofen. D. Calcium acetate. Answer: C. Ibuprofen. Question 6. A client on lithium therapy reports severe diarrhea and vomiting. What is the nurse's priority intervention? A. Reassure the patient these are expected side effects. B. Administer antiemetic medication. C. Hold the next dose and notify the provider. D. Encourage fluid intake. Answer: C. Hold the next dose and notify the provider. Question 7. A patient is scheduled to receive vancomycin. What should the nurse assess before administration? A. Blood glucose. Bowel sounds. C. Trough level. D. Hematocrit. Answer: C. Trough level. Question 8. A nurse is educating a patient about nitroglycerin sublingual tablets. Which statement indicates understanding? A. I will take 1 tablet every 10 minutes until the pain stops. B. I will swallow the tablet whole with water. C. I should store the tablets in a clear plastic container. D. I will call 911 if the pain persists after 1 dose. Answer: D. I will call 911 if the pain persists after 1 dose. Question 9. Which medication should the nurse question in a pregnant client? A. Acetaminophen. B. Lisinopril. C. Iron supplement. D. Docusate sodium. Answer: B. Lisinopril. Question 10. A nurse is caring for a patient with asthma prescribed theophylline. What finding requires immediate attention? A. Heart rate of 98 per minute. B. Restlessness and nausea. C. Oxygen saturation of 94%. D. Mild wheezing on auscultation. Answer: B. Restlessness and nausea. Question 11. Which client would require the nurse to question the administration of metoprolol? A. A client with hypertension. B. A client with bradycardia. C. A client with a history of myocardial infarction. D. A client with heart failure. Answer: B. A client with bradycardia. Question 12. A patient taking phenytoin for seizures has a phenytoin level of 25 micrograms per milliliter. What is the nurse's action? A. Administer the next dose as prescribed. B. Document as a therapeutic level. C. Hold the medication and notify the provider. D. Instruct the patient to take with milk. Answer: C. Hold the medication and notify the provider. Question 13. Which action is most important for a nurse caring for a patient receiving IV potassium chloride? A. Administer via IV push in emergencies. B. Infuse through a central line only. C. Monitor for signs of phlebitis. D. Dilute in saline and infuse slowly. Answer: D. Dilute in saline and infuse slowly. Question 14. A client with a penicillin allergy is prescribed cephalexin. What should the nurse do? A. Administer the medication with food. B. Monitor for rash after administration. C. Notify the provider before administration. D. Assess liver function tests. Answer: C. Notify the provider before administration. Question 15. What is the best method for the nurse to evaluate the effectiveness of pain medication? A. Ask the patient to rate pain relief. B. Observe facial expressions. C. Monitor respiratory rate. D. Check the time since last dose. Answer: A. Ask the patient to rate pain relief. Question 16. Which medication should not be administered to a client with a sulfa allergy? A. Ciprofloxacin. B. Furosemide. C. Amoxicillin. D. Acetaminophen. Answer: B. Furosemide. Question 17. A nurse is administering naloxone to a patient with suspected opioid overdose. What is the priority nursing action after administration? A. Administer a second dose immediately. B. Monitor respiratory status frequently. C. Reassess pain level. Doctor, prepare to discharge the patient. Answer: B. Monitor respiratory status frequently. Question 18. A nurse is preparing to give an insulin injection to a type 1 diabetic patient who is NPO for surgery. What should the nurse do? A. Hold the insulin and notify the provider. B. Administer the full dose as ordered. C. Administer insulin with dextrose. D. Give half the dose and monitor blood glucose. Answer: A. Hold the insulin and notify the provider. Question 19. Which patient scenario would require the nurse to clarify a medication order? A. Fentanyl patch for chronic pain. B. Metformin for a patient undergoing CT with contrast. C. Aspirin for coronary artery disease. D. Enoxaparin for postoperative deep vein thrombosis prophylaxis. Answer: B. Metformin for a patient undergoing CT with contrast. Question 20. A patient receiving gentamicin develops tinnitus. What is the nurse's best action? A. Document the finding. B. Reassure the patient it is temporary. C. Hold the medication and notify the provider. D. Encourage increased oral fluids. Answer: C. Hold the medication and notify the provider. Question 21. A nurse is preparing to administer IV metoprolol. Which assessment is most critical prior to administration? A. Potassium level. B. Heart rate. C. White blood cell count. D. Respiratory rate. Answer: B. Heart rate. Question 22. A patient with COPD is prescribed albuterol. Which patient report requires immediate follow-up? A. Mild tremors after use. B. Increased thirst. C. Chest pain after inhalation. D. Mild headache. Answer: C. Chest pain after inhalation. Question 23. A nurse receives a new medication order for a pediatric client. What is the priority action before administration? A. Confirm dose with another nurse. B. Ask the child if they've taken it before. C. Double-check the weight-based dose calculation. D. Administer the medication promptly. Answer: C. Double-check the weight-based dose calculation. Question 24. A patient receiving heparin drip suddenly develops severe abdominal pain and a drop in hemoglobin. What is the nurse's best action? A. Stop the infusion and notify the provider. B. Administer oxygen by a nasal cannula. C. Recheck vital signs in 30 minutes. D. Prepare for discharge. Answer: A. Stop the infusion and notify the provider. Question 25. Which medication should the nurse question in a patient with a known prolonged QT interval? A. Ondansetron. B. Loratadine. C. Acetaminophen. D. Ranitidine. Answer A. Ondansetron. Question 26. A client is prescribed methotrexate for rheumatoid arthritis. Which instruction is most important to reinforce? A. Take with vitamin C. B. Use a reliable method of contraception. C. Increase dairy intake. D. Avoid green leafy vegetables. Answer B. Use a reliable method of contraception. Question 27. A nurse is reviewing discharge instructions for a client on warfarin. Which statement indicates a need for further teaching? A. I will use an electric razor. B. I will avoid green leafy vegetables. C. I will notify my dentist about the medication. D. I will take aspirin for headaches. Answer D. I will take aspirin for headaches. Question 28. Which nursing intervention is most appropriate when administering a vesicant chemotherapy agent? A. Flush with normal saline before and after. B. Administer via central line. C. Warm the site before infusion. D. Use the smallest vein possible. Answer B. Administer via central line. Question 29. A nurse is caring for a patient receiving haloperidol. Which finding requires immediate intervention? A. Dry mouth. B. Sedation. C. Muscle rigidity and fever. D. Constipation. Answer C. Muscle rigidity and fever. Question 30. Which patient statement indicates proper understanding of levothyroxine therapy? A. I should take it with iron supplements. B. I will take it on an empty stomach. C. I can stop it when I feel better. D. I will take it at bedtime. Answer B. I will take it on an empty stomach. Question 31. Which action should the nurse take when administering oral ferrous sulfate? A. Give with dairy products to aid absorption. B. Encourage the patient to lie down afterward. C. Administer with orange juice. D. Offer with antacids to reduce gastrointestinal upset. Answer C. Administer with orange juice. Question 32. A nurse is teaching a patient about newly prescribed sertraline. Which side effect requires immediate reporting? A. Dry mouth. B. Increased appetite. C. Suicidal thoughts. D. Mild dizziness. Answer C. Suicidal thoughts. Question 33. A client with tuberculosis is prescribed isoniazid. Which lab value must be monitored? A. Serum creatinine. B. Liver enzymes. C. Blood glucose. D. Hemoglobin. Answer B. Liver enzymes. Question 34. A nurse is caring for a client who is prescribed naloxone. Which statement is true about its use? A. It has a long half-life. B. It should be given orally for best effect. C. Rebound respiratory depression is possible. D. It cannot be given more than once. Answer C. Rebound respiratory depression is possible. Question 35. Which client is at highest risk for digoxin toxicity? A. Client taking spironolactone. B. Client with hyperkalemia. C. Client with chronic kidney disease. D. Client taking calcium carbonate. Answer C. Client with chronic kidney disease. Question 36. A nurse is preparing to administer an opioid to a patient in pain. What is the most important initial assessment? A. Blood pressure. B. Pain location. C. Respiratory rate. D. Pupillary reaction. Answer C. Respiratory rate. Question 37. Which of the following medications should not be crushed before administration? A. Acetaminophen. B. Extended-release metoprolol. C. Lisinopril. D. Furosemide. Answer B. Extended-release metoprolol. Question 38. A patient is prescribed clozapine. What finding requires the nurse's immediate intervention? A. Sore throat and fever. B. Weight gain. C. Sedation. D. Dry mouth. Answer A. Sore throat and fever. Question 39. A nurse is teaching a patient about taking nitrofurantoin. Which patient's statement requires further education? A. I will take it with food to reduce nausea. B. It may cause my urine to turn brown. C. I will stop the drug when I feel better. D. I will complete the entire prescription. Answer C. I will stop the drug when I feel better. Question 40. Which action by the nurse is appropriate when a patient develops red man syndrome during vancomycin infusion? A. Stop the infusion and call the provider. B. Increase the infusion rate. Carefully slow the infusion and monitor symptoms. D. Administer epinephrine immediately. Answer C. Slow the infusion and monitor symptoms.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!